Hi guys, in today's lecture we will discuss carcinoid tumor and syndrome. This is very secretive tumor. Therefore, we have a secretive mnemonic as well by the name of Sir hides his car so secretly. So we will discuss this condition in detail. So let's start. Here you can appreciate carcinoid tumor and syndrome. Both are different. Okay, in carcinoid tumor there might be no symptoms, whereas carcinoid syndrome will have lot of symptoms due to this carcinoid tumor. Here you can appreciate presence of neuroendocrine cells. See, these neuroendocrine cells are peculiar. These are actually endocrine cells, but they respond to neuronal stimulation. Try to understand. Suppose this is your thyroid gland, and you guys know that there are four parathyroid glands as well. Let's take example of parathyroid glands. So here you can appreciate thyroid, and then you have parathyroid glands, right? These are your endocrine glands, and these parathyroid glands are responsible for secretion of PTH, and then they maintain the blood calcium levels. Whenever calcium levels become less, then these parathyroid glands get stimulated with the help of calcium sensor receptors, and then more of PTH will get secreted, and this more of PTH will increase the blood calcium levels. So this is normal mechanism of secretion from any endocrine glands. But there are few endocrine cells which respond to neuronal stimulation. Try to understand, particularly autonomic nervous system. You have G cells. G cells secrete gastrin, and you guys know that these G cells will secrete more of gastrin if there is more of parasympathetic stimulation. So these endocrine cells will respond to neuronal stimulation, and therefore these are known as neuroendocrine cells. And tumors arising from neuroendocrine cells are known as neuroendocrine tumors. You have pancreatic neuroendocrine tumors in form of insulinoma, glucagonoma, VIPoma, somatostatinoma, etc. Okay, so these are your G cells. These secrete gastrin, and if there will be more of parasympathetic stimulation, particularly mediated by vagus nerve, it will result into more of gastrin secretion. Okay, so there are neuroendocrine cells which are related to nervous system directly. Okay, here you can appreciate presence of nerves, and these will stimulate your neuroendocrine cells, and then ultimately these neuroendocrine cells will secrete particular hormones. Here in this case, G cells will secrete gastrin. In the same way, in the epithelium of gut and particularly respiratory system, and sometimes there can be tumor of these endocrine cells, and this particular tumor is known as carcinoid tumor, and this tumor will particularly secrete lot of serotonin, histamine, prostaglandins, bradykinin, resulting into various manifestations constituting the carcinoid syndrome. Okay, so let's discuss this topic in detail. Now let's understand our mega mnemonic by the name of Sir hides his car so secretly. This is ideal mnemonic for carcinoid syndrome. An ideal mnemonic should contain both the question as well as answer. So here you have Sir hides his car so secretly. Here car means your carcinoid syndrome. Now let's talk about other components of this mnemonic. In the starting you have Sir hides his car so secretly. Sir means your serotonin. This will be chief mediator released from your carcinoid syndrome, and this is going to cause lot of problems. And this will be degraded in form of 5-hydroxyindole acetic acid. So this hyd represents your hydroxyindole acetic acid. This will be detected in urine, and this will be main substance required for screening of your carcinoid syndrome. And then you have His. His means your histamine, that is second common mediator released from this particular tumor. And now you have So means your somatostatin. These tumors will express lot of somatostatin receptors, and this will be utilized for the diagnosis as well and for the treatment as well. Here second letter to so you have O. So main part of treatment will be somatostatin analog, that will be your octreotide. We will discuss this particular condition in detail. And plus somatostatin scintigraphy will also be used for the diagnosis of this particular tumor. And then you have last word as secretly, and these two words so and secretively will make SS, and this SS will actually represent your somatostatin scintigraphy. This will be very useful for making the diagnosis. So I have repeated this somatostatin scintigraphy twice because this is actually very important investigation for diagnosis of any neuroendocrine tumors, because these neuroendocrine tumors express lot of somatostatin receptors. Okay, so this is our mnemonic. We will keep on revising this particular mnemonic. Okay, here you can appreciate neuroendocrine cell, which is going to secrete lot of chemical mediators in form of hormones on neuronal stimulation. And tumor of these neuroendocrine cells is known as neuroendocrine tumor. And one of the neuroendocrine tumor is your carcinoid tumor as well. And here you can appreciate presence of somatostatin receptors over these tumor cells. See, these neuroendocrine cells express lot of somatostatin receptors, but whenever there is development of tumor, the number of somatostatin receptors increases further. Therefore, for diagnosis, we will use somatostatin scintigraphy, and in treatment as well. These somatostatin receptors will be stimulated with help of somatostatin analogs. So, primarily this tumor will be treated with help of octreotide, that is somatostatin analog. This somatostatin is universal inhibitor. This is going to inhibit each and everything. That is, this is going to inhibit the secretion of histamine, serotonin from this tumor, resulting into decrease in manifestations. In fact, this is universal inhibitor because somatostatin can inhibit its own secretion as well. Okay. Now here you can appreciate various sites from where carcinoid tumor can arise. Actually, these cells, that is neuroendocrine cells present in various epithelium, can result into carcinoid tumors. Particularly, they are present in epithelium of gut and respiratory epithelium. Here you can appreciate the appendix. So these tumors mostly arise from appendix. So this is most common site for carcinoid tumor. And you have other sites as well. Take example of stomach, take example of pancreas, take example of kidney. Other site can be your lung. We also talked about the respiratory epithelium. Now try to understand, whenever tumor will arise from the epithelium of gut, this more of serotonin and histamine will first reach liver, and therefore liver will metabolize and catabolize these histamine and serotonins, and it might not result into any of the symptoms. So this particular thing will be known as carcinoid tumor without any manifestations. But whenever it will occur in respiratory epithelium, now this is going to bypass your liver. Now more of serotonin and histamine will exist in blood for longer time. Therefore, this will result into symptoms in early phase as well. And now this will be known as carcinoid syndrome. So carcinoid tumor, if presents with symptoms, this will be known as carcinoid syndrome. Okay. Now let's discuss carcinoid syndrome in detail. Having understood primary sites for carcinoid tumor, now this is very easy to understand carcinoid tumor as well as carcinoid syndrome. Here you can appreciate that tumor arising from gut epithelium, and main site for this is your appendix. Now try to understand, whenever tumor will arise from gut, this secretion will first reach your liver, and liver will try to degrade all of the serotonin and histamine. Therefore, clinical features due to these chemical mediators might be absent unless there is metastasis of liver itself. But whenever tumor will arise from bronchi, now histamine and serotonin are not going to reach the liver. They will reach the heart first. Therefore, these chemical mediators will increase in blood, resulting into lot of symptoms due to primarily serotonin, and now this will be classified as carcinoid syndrome. Try to understand, if you have carcinoid tumor of gut, now more of serotonin will reach liver, and liver will destroy this serotonin. Therefore, there might be no clinical features. But if this happens to be in bronchi, this will directly reach your heart, and heart will pump it to various body tissues. Now there will be lot of clinical features. So if you have carcinoid tumor with clinical features, now this will be known as carcinoid syndrome, right? In case of carcinoid tumor arising from gut, this will most commonly metastasize your liver. And if there will be metastasis of liver itself, now these chemical mediators will of course get released into blood, and then they will cause a lot of problems resulting into carcinoid syndrome. Now let's understand the pathogenesis. In this particular tumor and syndrome, main chemical mediator is your serotonin. Remember the mnemonic. We have started with Sir hides his car so secretly. So Sir is your serotonin. This serotonin is actually 5-hydroxytryptamine. As the name itself indicates, this might be synthesized from tryptophan. So tryptophan is primary amino acid which results into formation of this serotonin. This tryptophan is also required for the synthesis of niacin. Now try to understand. So this tryptophan gives rise to serotonin and other biochemical substances. In this particular lecture, we will mainly focus on serotonin, histamine, and little bit of prostaglandin and bradykinin. So this tryptophan produces serotonin. Now, this serotonin will cause lot of problems, and this serotonin can reach liver first, and liver might degrade it in form of 5-hydroxyindole acetic acid. We have already talked about this 5-hydroxyindole acetic acid. This can be detected in urine, and this is very important component for the screening of carcinoid syndrome. So this is your 5-hydroxyindole acetic acid. This will be required for the screening of carcinoid syndrome. Okay. Now, if there is metastasis of liver, or if the carcinoid tumor is arising from the bronchus, then these chemical mediators will escape in blood and cause lot of problems. This serotonin in particular will stimulate your GI tract, and this will increase the motility as well as secretion. Therefore, this can result into secretory diarrhea. This serotonin can cause fibrosis. Therefore, this can cause fibrosis of cardiac walls as well. Particularly, this will involve right side of cardiac walls. It can result into tricuspid regurgitation and pulmonary stenosis. And over and above, this can cause bronchoconstriction along with histamine and prostaglandins, and this can cause flushing as well, mainly due to histamine. So there are various manifestations which are going to occur due to various chemical mediators, primarily due to serotonin. So here you can appreciate serotonin as main chemical mediator, that is hormone, and here you have histamine and bradykinin as other chemical mediators, and sometimes there can be prostaglandins as well. This serotonin will be responsible for the secretory diarrhea. This is going to stimulate the GI tract, and this is going to also stimulate the secretions from GI tract. Okay, and therefore there will be more of motility and more of secretions, resulting into secretory diarrhea. This will cause fibrosis as well, and this fibrosis can attack heart valves, and by attacking heart valves it can result into tricuspid regurgitation or pulmonary stenosis or both. Try to understand, this is your heart, and we have understood that this hormone will be released from epithelium of gut or respiratory system. So this is going to reach the right side of heart first. So here you have carcinoid tumor, and then you have more of 5-hydroxytryptamine. This is going to reach the right side of heart via inferior vena cava. So this will first trouble your tricuspid valve, resulting into tricuspid regurgitation, and after tricuspid regurgitation this will also reach your pulmonary valves. Now this will cause pulmonary stenosis. So you have two major manifestations in heart in form of tricuspid regurgitation and pulmonary stenosis. What are other manifestations? This histamine in particular will cause vasodilatation. Therefore, this will result into flushing. Okay. Now, this histamine and prostaglandin will also cause bronchoconstriction, resulting into wheezing episode. And this histamine can also result into severe itching. So these are various manifestations which can result due to carcinoid tumor, resulting into carcinoid syndrome. Okay, and principal mediator is your histamine, serotonin, prostaglandin, and bradykinin. Let's again recap. This is your neuroendocrine tumor cell resulting into carcinoid tumor, and then tryptophan will produce lot of chemical mediators, mainly your serotonin. And now serotonin along with other chemical mediators will produce lot of symptoms. So let's recap. And here you can appreciate the end product of metabolism, that is 5-hydroxyindole acetic acid, detected in urine as main screening tool for carcinoid syndrome. So let's recap each and everything. We did talk that there will be lot of chemical mediators, particularly serotonin. So let's revise one by one. This serotonin will cause secretory diarrhea. This serotonin will also cause fibrosis of cardiac valves, resulting into tricuspid regurgitation plus minus pulmonary stenosis. There will be more of histamine. Histamine, you guys already know, will cause itching, and this will also cause flushing. Along with this, you have prostaglandins as well. Along with this, you have bradykinin as well. These will also cause your bronchoconstriction, and this bronchoconstriction will result into wheezing episodes. So these are various clinical features in case of carcinoid tumor resulting into carcinoid syndrome. Now let's appreciate a very important thing. We did talk that this 5-hydroxytryptamine, that is serotonin, is synthesized from tryptophan, and in case of tumor, all of the tryptophan will be diverted toward the production of 5-hydroxytryptamine. Try to understand. This tryptophan is principal amino acid which will result into synthesis of 5-hydroxytryptamine, that is your serotonin. Right? So in case of carcinoid tumor, more of tryptophan will be diverted towards synthesis of 5-hydroxytryptamine. Less of tryptophan will be left out for the synthesis of niacin. Therefore, serotonin secretion will increase, whereas niacin, that is vitamin B3, secretion will decrease. And because there will be decreased synthesis of niacin, this will result into pellagra. And you guys understand the clinical manifestation of pellagra memorized by 3D, that is diarrhea, dermatitis, and dementia. So again, this is resulting into diarrhea. So this clinical condition, that is carcinoid syndrome, will result primarily into diarrhea, either by itself or due to its complications. So this is your B3 vitamin, that is niacin, and deficiency resulting into triple D, that is diarrhea, dementia, and dermatitis. Okay, particularly this dermatitis happens at sun exposed areas. Okay, now as we are talking about neuroendocrine tumors, in the same way you have pancreatic neuroendocrine tumors as well. We are going to discuss all these neuroendocrine tumors in detail. And in neuroendocrine tumors, you will always appreciate presence of various clinical manifestations represented by triads. Take example of this VI-poma. This VI-poma presents with Vada syndrome, that is watery diarrhea, hypokalemia, achlorhydria. In the same way, you have glucagonoma presenting with 4D. Again, you have dermatitis, diabetes, deep vein thrombosis, and depression. In the same way, you have carcinoid syndrome. Multiple clinical features will be explained with help of serotonin, histamine, bradykinin, and prostaglandins. And then it can result into pellagra. And this pellagra can be explained with help of this triple D. So whenever we talk about neuroendocrine tumors and their manifestations, we always try to include few triads. We will discuss all these conditions in next lecture in detail. Okay. Right, now let's recap. Here you have neuroendocrine tumor cells, and in this case we are talking about carcinoid syndrome. And here you can appreciate tryptophan, and this tryptophan will result into formation of serotonin, that is principal chemical mediator of carcinoid syndrome. And in this case there will be less of production of niacin, we have already understood, and this will be metabolized into 5-hydroxy indole acid, which can be detected in urine as a screening tool for diagnosis of carcinoid syndrome. And here you can appreciate multiple clinical features resulting due to excess of chemical mediators. And now this particular tumor will be labeled as carcinoid syndrome because this will present with lot of symptoms later on. Okay. Right, now let's talk about the investigations required for the diagnosis of carcinoid syndrome. We have already discussed that this 5-hydroxytryptamine will be degraded into 5-hydroxyindole acetic acid, and this will be detected in 24-hour urinary collection, and this will be required for the screening of carcinoid syndrome. Okay, now try to understand. In case this tumor is bigger in size, this can be localized with help of imaging techniques. Therefore, you can go for MRI, CT scan, or you can also go for endoscopic ultrasound for detection of carcinoid syndrome. But sometimes the tumor might be very small, or sometimes there can be metastasis. So to detect tumor from every site, you have very important investigation by the name of somatostatin scintigraphy. Now, what is basis of somatostatin scintigraphy? We have already discussed that these neuroendocrine tumors will express lot of somatostatin receptors. Therefore, somatostatin analogs will go and bind to these receptors. And if these somatostatin analogs are radiolabeled, then we can scan presence of these somatostatin analogs with help of gamma camera. Either it can be carcinoid from bronchial epithelium or there can be carcinoid from gut epithelium. So these are scans of somatostatin scintigraphy. This is part of nuclear medicine. Now let's discuss treatment of carcinoid tumor. We have been discussing that these tumors will express lot of somatostatin receptors. Therefore, principally these tumors are treated with help of somatostatin analogs. These somatostatin analogs are universal inhibitors. They will in fact inhibit their own secretions. In the same way, these somatostatin analogs will inhibit the secretions from these neuroendocrine tumors as well. And somatostatin analog of interest over here is your octreotide, and long acting octreotide, that is your lanreotide. So these will act on the somatostatin receptors and they will decrease the secretion of 5-hydroxytryptamine in particular, resulting into decrease in symptoms. And for definitive management, there can be surgical removal of the tumor. So this is treatment of your carcinoid syndrome. Now let's recap our mega mnemonic, that is Sir hides his car so secretly. An ideal mnemonic will have question as well. So this car is your carcinoid syndrome. Now other components are very easy. You have SIR in form of serotonin as principal mediator in case of carcinoid syndrome, also represented as 5-HT. And then you have main metabolite of serotonin in form of 5-hydroxyindole acetic acid, which is required for the screening of carcinoid syndrome. And then you have second mediator responsible for various clinical features, particularly itching and flushing, that is your histamine. And then you have other components. You have so means somatostatin, and we have been talking about this somatostatin from quite long time, and this somatostatin analog will be required in treatment as well, that is your octreotide. The second letter after S is O, that is somatostatin, and you can also memorize octreotide in this particular mnemonic. And we have also discussed about somatostatin scintigraphy. So this S and this S, in case you forget, you can remember somatostatin scintigraphy as one of the important modalities for the diagnosis of carcinoid syndrome. So having understood this mnemonic, we are now done with our topic, that is carcinoid syndrome. I hope you guys enjoyed this particular mnemonic as well, okay? Because this mnemonic has secretly solved our big problem of understanding of this carcinoid syndrome.